Okay.
Hi, I'm Dr. Jay Culkin at WIFH, and welcome back to another one of our Ask the Doctor Facebook Live sessions. Once upon a time, we did a session on explaining the difference between the non-invasive fat removal techniques. We talked about some of the freezing fat technology that's out there, and we talked about Sculpture, the melting fat through your skin technology. Well, since then, we've gotten lots of questions about the difference between melting fat through the skin and actually doing minimally invasive procedures like smart lipo. Smart lipo, I've only done 9,000 of them here at WIFH over the last 10 years, fortunately without any complications. And what we have done is we've learned over the years how to do this awake, without putting people to sleep, and yet getting as good or better results than with the old style of liposuction. So today I want to recap for those of you that are interested in these two technologies what the differences are. Let's start with non-invasive fat reduction. This is the Sculpture machine. And what we do with Sculpture, take out some of these frames, is we actually put these frames, we have small ones and we have large ones, and if we're doing a larger area we would put the frames across, let's say, the abdomen and the upper abdomen or the lower abdomen, and then we would take this laser, and these lasers actually pop into these frames, and we attach them to your waist with a belt. And these lasers, there are 4 of them on the device, these lasers will put laser energy into the fat, destroy fat cells. Excuse me. 25 minutes on the machine for those 4, another 25 minutes in the lower abdomen. We might be doing the inner thighs, the outer thighs, the back flank or the back bra fat area, several different places that we do. But what these do is they melt fat through the skin. We lose up to 24% of the fat in that area, and we've learned that we should do 2 sessions spaced 3 months apart. Now, you're lying on this table or chair, you're having this procedure done, you're in here for an hour or 30 minutes. What next? What next is you get up, you walk out of here, and you go about your day. If you plan to go to yoga class or go to the gym that day, have a nice time. We see reduction between 6 and 12 weeks. I like my patients to do their second procedure at 12 weeks, and we find that we get a nice reduction. Now, how big a reduction? Or I should say, can we get the same reduction with these non-invasive technologies as we can with smart lipo? No, smart lipo gets us more reduction. And let me explain how smart lipo is done. In my office, it's done awake. We have an operating room here in the office. Our patients are draped for a surgical procedure. They feel a couple of bee stings. Let's look at the arm. If we were doing the arm lipo, we would do a little bee sting right here, make a tiny poke opening, and then we would use a long instrument about the size of this thing, and we would pump numbing fluid in. Then we take our laser, and this is actually a laser fiber. It's coiled up, but we straighten it out, and we actually take that laser fiber and we melt the fat. When we're done melting the fat, we take this skinny little cannula and we suction the fat out. We do the same thing on the other side. That procedure in my office takes about 30 to 40 minutes. At the end of that procedure, my patients get up, walk out of here, and can drive themselves home. That evening, they might take a pain pill, they might use ibuprofen, but for small parts like the arms or the thighs, they're working the next day. If it were an abdomen that we were doing, we would do it probably through 2 openings in the navel, 2 openings down low, and for larger people, 2 openings, little ones under the breast. Same procedure, numbing fluid, melt fat, suction. Still, these patients can get up and walk out of here and drive themselves home, but they might take a day or 2 before they go back to work. And they might use a pain pill that first night. So if we were talking about size reduction with smart lipo on an abdomen, typically 2 sizes, a couple of inches in the waist. If we were talking about sculpture on the abdomen, typically about a 1 size reduction. Hard to predict with the non-invasive technologies. But we have been seeing in our office a lot of people, I just saw one 5 minutes ago, frankly, that had fat freezing, $2,500 spent, no results. She's here today to see me to have smart lipo. Sculpture, we've done very well. We paint reasonable expectations. We choose our candidates carefully. We know who we believe this will work better on. If someone is clearly not a candidate, we will let you know because there is no reason to waste your time and money. So I hope that that paints a clearer picture for the difference between the non-invasive and the minimally invasive procedure. If you have, do we have any questions that have come in?
No, just a few highs.
A few highs, okay, good. Well, hello. And typically we get lots of questions later. This will be viewed for days and weeks and months to come. And we hope you join us again. We continue to do these series on Facebook Live. We get lots of feedback about it. People find it very informative. And if there are any subjects that you would like us to cover sometime, just let Lindsay know in the office. Otherwise, thanks for joining us at WIFH. Have a great day. We'll see you again soon.